Our next speaker, David Porter of Apposite Capital, has worked in the private equity and investment banking space for 30 years, set up Apposite in 2006, and has worked with the biotechnology industry, but also very significantly with healthcare reform. David, thank you for joining us today. And this is the final session before we have a panel discussion, and then the final panel. Please join us.
Good afternoon. I'm going to be a bit depressing. I don't apologize for that. That's the reality. You've been hearing about all the problems that the world has in terms of resources, pollution, recycling, etc., etc. And I'm afraid there is a huge problem about to occur in healthcare. This is my title. This is my I'm not selling you anything slide. And this is my problem side. And the reality is that we're all, I can feel it greatly, we're all aging. And unfortunately, one of the problems with aging is that everything that's half going wrong gets worse as you get older. And China, for instance, which we were talking about earlier, has a very rapidly aging population dynamic because, of course, the one-child policy. But it's true in every single country in the world. And the other problem is, which relates to the app that we were just hearing about, getting on your bicycle, we have a massive chronic disease problem. And it's because we like to eat, and we like to eat certain foods that are not good for us. We don't always like to exercise. We like to drink. We quite like our recreational drugs, etc., etc., etc. And if you keep doing those things, you build up type 2 diabetes, you build up obesity problems, and that leads to a whole load of obesity and lifestyle issues. The fracture of the family unit, you might think, is a slightly different point, but it is a relevant point because what's happening now is that whereas Granny was looked after the children, she's not now, she's put out for the society to look after. And one of the real problems with getting older is not only the incidence of cancer goes up, the problem with your chronic disease gets much worse, but the real time bomb which is sitting there is dementia. And unfortunately, as you get older, all types of dementia, Alzheimer's is the one that gets a lot of press, elderly mental impairment, but there are a whole number of them, unfortunately get worse and worse and worse. Now, this wouldn't matter if the healthcare system was in great shape, if there wasn't a breakdown in the healthcare system going on. But unfortunately, the healthcare system is not in good shape. If you look at the infrastructure of the healthcare system globally, I'm not talking particularly about the UK, this is a global issue. Politicians who tend to be very involved in healthcare, because healthcare is a very political issue, like big shining buildings. They like things where they can cut a rope and they can let themselves into a beautiful building. Trouble is that that's fine if you've got your myocardial infarction or a heart attack or whatever. It's not so good for long-term treatment of chronic diseases. It's not good for reducing the cost of healthcare. The second problem is that, because I mentioned this is a political thing, this is an absolute minefield. Our health minister, love him or hate him, wanted to make a reform in the way that healthcare was commissioned in the UK. And I think the best summary of the sort of debate that went on that came from the guy who chairs the Commons Select Committee on Healthcare. And he said, the arguments against the bill are hugely exaggerated. The arguments for the bill are hugely exaggerated. And the whole thing came into a storm, particularly unrelated to actually what was happening. You try and change anything in healthcare and you hit a terrible political minefield. The organizations are bureaucratic. UK has the NHS, over 1 million people, centrally driven. You know, I don't think one can say more. Google effect is another problem, which is rather like the fracture of the family unit. Not only are we not looking after our elders, but our elders are realizing from the internet that they should be getting the best possible care. So the demand for healthcare is going up and up and up. People estimate about 4 to 5% per annum real increase in the UK in healthcare demand. Problem is, NHS is about 90% of UK healthcare, and the government hasn't got any money. There is a problem. This is just sort of more depressing statistics on what I've said. The growing elder population, the increase in spend with age over there. This is a very important chart that nobody talks about, and it's rather sad. The number of deaths is about to increase. If you can see it, it's a bit difficult to see, but the pink line, the pink purpley line, I'm a bit colorblind, is the death rate. It's about to go up very rapidly. And because big cost is in the last 6 months of life in healthcare, that is going to ratchet up that growth and expenditure that I was talking about. So, what can you do in an entrepreneurial way, in the way that we like to work, to do something about this? And we've got 4 themes that we're working on in our current fund, and we're about to launch another fund which will be following those 4 themes. And the first one is absolutely key, and that is getting costs down. We cannot look after the growing healthcare demand unless we increase efficiency. NHS, in its 60-plus years, has managed about 1% per annum increase in efficiency. Given that demand is growing at 5-6%, and that they can only get efficiency in the past at 1%, and there's no more money, we have a problem. So we have to get costs down. And what are we doing at Apposite about that? Well, we're putting things into lower cost care settings, keeping people at home, keeping them stable, out of hospital, out of that gleaming hospital because it's so expensive. And one of the best ways of doing that is to use technology. The fact that everybody, even Granny, has a mobile means that you can use technology to help keep people at home. And very focused and efficient operations, not sort of large, inefficient models, but much more focused one. Second thing we're doing in our fund, and we'll be doing it again, is taking ideas that have worked in other countries and putting them into the UK. Because the UK's had a public system, it tends to always be starved of capital. So anything that requires capital tends to be in a short supply in the UK, and I'll illustrate that in a second. The other thing we're doing is working with manufacturers and distributors of healthcare products to make sure they're used better so that the consumer gets better value. And the other one is joint venturing and partnering with people that need cash, be that the NHS, which is always short of capital, be that social enterprises, be that anybody where we can put our capital and our expertise to make things work more efficiently and at lower cost. Here are 3 of our companies that we've invested in, very briefly because I'm going to be out of time. Shorecalm, right in the real key area, home care, delivering health at home, out of the hospital, keeping people stable with chronic diseases or long-term health problems, really working to make sure that they don't go into A&E or they don't have to go into hospital for a while, keeping them stable. Absolutely key, very profitable from a sort of point of view of return, but a great business, and we'll do that again in the next fund because this home care is absolutely key to getting efficiency up. Middle one, slightly different, a very leading edge in sort of more the social care area, where we were taking very underprivileged children who basically had been abused mentally, physically, sexually, or a combination of that by their parents. And sadly, because we like our drugs and our drink in this country, there are quite a few children like that. And doing a lower cost but much more effective way of looking after them. The high cost way is to put them into residential care. I can bore for England on why that's not as good as foster care. We have a single person to child relationship with very highly trained foster carers, university degrees in therapeutic foster care, etc., who can really help those children, and the scholastic achievements are very, very important. Another situation where you've got a better, lower cost way of working. And the final one is taking an area where sadly the UK has a tremendous shortage of capacity. Radiotherapy is one of the 3 major treatments for cancer. Hopefully, if you ever get cancer, and unfortunately 1/3 of you will get cancer before you die, it can all be cut out, and that's fine. And if you have good diagnostics and you get it early, hopefully that's what will happen. Sadly, not all cancers are like that. About half the cancers require radiotherapy, which is a way of basically clearing up the tumor cells and increasing your chances of survival. So half the cancers that are cured have a radiotherapy component. Little known fact, UK, about 6th richest country in the world, has 60% of its radiotherapy capacity that the World Health Organization says it should have given the population demographic. They're actually a postcode lottery. People don't know this in radiotherapy. So some places you don't get it at all. Bad news given that 50% of cancers are cured with a component of radiotherapy. We want to do something about this. We wanted to do it with the NHS, but we couldn't get them moving, so we did a private solution, and now we're treating some NHS patients, and we're basically giving the best quality radiotherapy you can have. And one of the problems with healthcare systems is that because they tend to always be short of money, and because they tend to take a short-term view, not a long-term view, they tend to sometimes be penny wise, pound foolish. Our radiotherapy is more expensive to do because it takes longer, but it spares healthy tissue. That means 5-10 years out, if you've had, say, breast cancer and you've had radiotherapy up here, you're less likely to have a problem with your heart or with your main arteries, etc., because of damage from radiotherapy treatments in the past. Very important, very successful company. Changing now the modality. I think you will see slowly the NHS will begin to change what it does in radiotherapy because we're causing a little bit of friction in the system. So, what are the requirements of change? You have to be able to take risk. I think we, as risk takers by nature, are more able to do that than public systems. We have to get a more grown-up political and media debate. It's so sad. Dilnot came out, reported on the whole issue of elderly care. Where's it been done? Kicked under the table. It's a very sad debate. No one wants to have it. No one wants to be honest. It's all political. It's very sad. Regulatory mechanisms and quality culture. The key issue is everything has to be highest possible quality. You're dealing with people's lives here. This is really important stuff. And we need a culture that celebrates success and entrepreneurial achievement rather than all this swirling politics, which doesn't do any good, I would politely suggest. How do we scale our solutions? Well, for us, the key thing is quality. We get external people to come and audit our companies even though we don't need to. I can bore Fringle on that, but I think you're standing up, so I need to be moving a bit quicker. Quality builds sustainability. It builds barriers to entry. It builds companies that can then grow and grow and grow. Socially responsible investment also builds sustainability. Environmental, social, governance quality builds sustainability. And the other thing is performance management is absolutely key. Thank you.
Brilliant. Thank you very much, David, and thanks very much.